Welcome, and thank you for attending. This is the first in a series of IHE domain webinars. Today we will update you on the IT infrastructure, or ITI domain, and what's new this year for us. And we will also see if we can whet your appetite for Connectathon. Our intended audience is people interested in the IT infrastructure domain, or interested in participating in the development of ITI's profiles, or perhaps interested in Connectathon, or people who have heard about IHE but do not know much about it. All that to say, I guess if you are a Connectathon veteran, you're going to hear a lot of stuff you already know here, but you're welcome to stay. And see if we can get these slides to advance. There we go. Here are your gracious hosts for today. My name is Levy. I'm with Corepoint Health. And I think my first Connectathon was in 2004. And I've been a member of the IT Infrastructure Technical Committee for about 3 years now. And with me is Lynn Felhofer. Lynn, you want to introduce yourself?
Good morning, everybody, and welcome. My name is Lynn Felhofer. I wear a couple hats for IHE. I am the IT Infrastructure Technical Project Manager. That means that I support the Technical Committee as they develop their specifications and participate with the committee in that role. And then following the completion of the specifications, then I oversee testing. So I write the interoperability tests that are run at the Connectathon. I also perform that role for the radiology and quality research and public health domains. I also have supported the overall technical management of the Connectathon, and I've been doing this role happily since 2005, and hope to be able to share that expertise with you and be a resource for you as you prepare for implementing ITI profiles and testing at the Connectathon.
Okay, wow. So here's what we'll cover today. The goal of this webinar is to give you enough information about the ITI domain and its profiles to get you excited about implementing them in your products or communities, and hopefully even getting involved. Another goal is to connect you with the people that can help you get started on preparation for Connectathon and participation in the IHE ITI community. So, excuse me. So rather than drown you with technical details, we'll show you where to find more information and help you get connected to the right people and websites that can fill in the gaps. We're hoping to exploit your curiosity here and get you to join ITI's committees and participate in Connectathon. And feel free to ask questions in the WebEx chat window as we go, and we'll let you ask questions at the end. We tend to use a lot of acronyms and IHE jargon. So if you're wondering about something, chances are so will people who listen to the recording. So please don't be shy. So this webinar will cover the IT infrastructure domain. IHE has lots of domains, including patient care coordination, radiology, quality research and public health, patient care devices, and more. And each domain will have a webinar in this series, so we just got lucky and drew the first number. The work product of all the domains is the creation of integration profiles, often called just profiles or IHE profiles. Each domain's integration profiles are published in a technical framework. And our domain owns a lot of profiles. Here you see a list of categories. Unlike other domains which focus on one aspect of healthcare, ITI's profiles are used more broadly. For instance, we all pay attention to security and privacy no matter what area of healthcare we are focused on. And some ITI profiles serve as the general basis for other domains' profiles. So you could say ITI kind of takes care of the back office stuff, if you will. So sharing information between clinicians, facilities, et cetera, is becoming increasingly important over time. You can see we have a lot of profiles here dedicated to that sharing. We don't have much time today, so again, we're not going into all the technical details, but you can find more information about all of these profiles by reviewing the educational materials and technical frameworks. The XD stands for Cross-Enterprise Document. We started with XDSB, Cross-Enterprise Document Sharing, within a community. And the XDSB profile is one of our most tested and implemented profiles. We then added profiles for use cases like point-to-point exchanges on physical media or point-to-point across a network, which those of you familiar with the Direct project will recognize, as much of Direct was based on the XDR profile. We then expanded into sharing documents between established communities, like between HIEs, and then added use cases like subscribing to a document to see when it gets updated, things like that. There's lots of detail represented here. If any of these profiles match use cases you are interested in, again, we would suggest that you start with Volume 1 of the technical framework. We have a number of different patient management profiles. These cover use cases from patient administration through patient matching and querying. Some are available in HL7 V2 or V3, and a couple are now compliant with FHIR DSTU2. You can also see 3 profiles dealing with provider information as well. ITI security and privacy profiles cover the basic A's of privacy and security. That's authentication, authorization, access control, and audit. ITI's ATNA profile is one of the most implemented privacy and security profiles in the real world. Various technology is used by these profiles, including FHIR, RESTful web services, LDAP, certificates, and others. And speaking of REST, it has gained a lot of recent popularity in healthcare with the rise of the use of mobile devices. The profiles listed here are in other categories, but we kind of put them in their own group as they all utilize REST. And in many cases, you can see they are based on FHIR DSTU2. We said earlier some ITI profiles provide technical underpinnings that are customized by other IHE domains like patient care coordination or quality research and public health. We have a couple of examples here. First, RFD. RFD defines a general form-based exchange of data, and the quality research and public health domain has defined profiles for exchange of custom forms for public health use cases such as early hearing detection, family planning, drug safety, vital records death reporting, and more, and all those based on the RFD profile. And the XDW profile for managing clinical workflows is based on the human task standard. The patient care coordination domain has defined XDW-based workflows for e-referral and telehome monitoring, and the radiology domain is currently working on an XDW-based profile for remote reading workflows. Again, all of these integration profiles are published in the ITI technical framework. If you've never read one technical framework before, there's a link at the bottom here to some guidance on how to navigate them. That's a 10-minute webinar by Steve Moore, which helps you get to the information you need in the technical frameworks more efficiently. So we definitely recommend that if you've never dealt with technical frameworks before. Okay, so what's new this year? What have we been up to? And the first thing on the list here is advanced patient privacy consent. So we've had a basic patient privacy consent profile for several years now. And it defines the format of a patient privacy acknowledgement document containing the description of what the patient consented to and a list of codes indicating the policies they agreed to and a time range indicating the effective time of the consent. So the new advanced patient privacy consents profile enables creating privacy policies with more refined consent to either provide or restrict access to clinical documents. So for example, a patient might grant access to his data to the staff of a specific facility. So a use case for this might be a patient visits the hospital for a hip replacement. After the procedure, the hospital arranges post-discharge care at a post-surgical care facility. That facility can be granted access to what happened at the hospital by facility. You know, they don't have to know which physicians it is or anything like that. APPC also allows a patient to withhold consent to disclose information related to a specific order, for example. So say a patient goes to his primary care provider for screening of sexually transmitted diseases, and he happens to be a nurse at the local hospital down the street and is concerned, obviously, that his colleagues may have access to that information. So APPC could be used to deny access to hospital personnel, i.e. as coworkers, to see anything to do with that order or the results related to it. So that's APPC. We also added a RESTful query to ATNA so that the audit logs can be queried. And we have an ongoing effort to redocument our document sharing profiles. And this year, some work was done around on-demand documents. We added a mobile alert communication management profile. And then last fall, FHIR went from DSTU1 to DSTU2, so these last 4 work items involved updating our profiles that were based on FHIR to align with DSTU2. So ITI is always looking for new members. Membership that is varied in expertise, background, and even geographical location leads to better standards. If you work in healthcare at all, you have something to contribute, and we'd love for you to come and help us. ITI is global. The work that we do is sponsored by these 2 organizations, one in North America and one in Europe. And you can see active members of the planning and technical committees of ITI come from all over the globe. If you'd like to expand the list, we'd be happy to have you join us. And so I'm going to talk a little about the IHE development cycle. So if we start at the bottom left here, first proposals are called for. And after some voting, a list of work items is developed for the year based on several criteria, but we end up with a list of work items that we think we can actually complete in the year. Work items go through several months of development. Then they are published for public comment for a month. Then the committee meets again to assimilate all those public comments into the documents and republish those. And at that point, the documents are mature enough for people to go off and begin implementing them into their products. And then after a few months, in January in Cleveland and in April in Europe, we get together for a week-long testing event that we call the annual Connectathon. After that, there is a huge opportunity to showcase your products at the HIMSS annual conference in their interoperability showcase. And eventually we end up with products in the marketplace that are more interoperable. So that kind of gives you an idea of the IHE-related activities on an annual basis. And in general, the left side represents IHE committee activities. this part over here, and the other side over here represents implementation, testing, and deployment. So we can kind of restate that information here in a table. This is the same information from the last slide, but with accurate dates for the current cycle. Some people do better with text instead of pictures. It really takes very little to participate. It may be just reading a work in progress and offering feedback now and then, or more if you like. If you're interested, we have something for you in whatever size commitment you can make. Most people are very wary of kind of getting sucked down a rabbit hole and having all their time eaten up, and it's just not like that for us. We'll be happy to use whatever time you can give us. The only requirement for committee participation is for your organization to become a member, which is relatively painless. And though public comment participation is open to everyone. So you can go to IHE.net/join to become a member, and then email the co-chairs of your committees to get hooked up to activities that are relevant for you. If you're unsure, you could email those co-chairs before you join, and you know, talk about what a good fit for you might look like, what that participation might entail. Here are some benefits to that participation. Again, all proposals are voted on by the planning and technical committees in, say, the October-November timeframe, and development begins pretty much immediately. Work groups are formed around each new work item to develop a new profile or whatever that work item might be. And members who are interested in monitoring or influencing the emerging profiles typically participate in the development of them. We always need help and would love to have you. Participation can range from being primary author on a work item down to just providing comments during the public comment period. There's a whole range of depth to participation, and every little bit helps. So at this point, I'm going to turn it over to Lynn if I can figure out how to do that. And I think that'll do it right there.
Okay. I'm going to remind folks that that if you have questions for either Ben or me, we welcome those, and you can enter those in the chat window. There will also be an opportunity at the end of the presentation to ask questions as well. So we welcome that as we go along. The focus of my presentation will be Connectathon testing with a little bit of thoughts of ITI in the background. So as Ben walked through that circle of our annual cycle, a key portion of what makes IHE profiles solid is not just the fact that people sit around a table and apply their expertise to write specifications, IHE profiles, but also the fact that those profiles go through a trial implementation phase, which includes sending them out, having people do implementation, testing them at Connectathon, and the outcome of that implementation gets fed back in to improve that documentation. And IHE profiles don't become final text until they have the rigor of ensuring that they're implementable, testable, and that when people follow the specifications, it actually results in interoperability between vendors to solve a given use case. So our annual Connectathon, which is a week-long event in both North America and Europe, equivalent events, overlapping staffing to ensure consistency in both arenas, the annual Connectathon is there. There are some domains, such as eye care and radiological oncology, which have focused events, Connectathons just on their domain. But in this presentation, we're going to be talking about the cross-domain large Connectathon week-long in both North America and Europe. And then, as Ben mentioned earlier, many participants in the Connectathon choose to follow on that testing opportunity with the opportunity to demonstrate their IHE capabilities at the HIMSS annual conference at the Interoperability Showcase. In other regions of the world, such as Asia and Europe, there are equivalent demonstration opportunities, but because the HIMSS Showcase is the next one, we'll focus on that in this presentation. So this slide is just intended to illustrate that the Connectathon and the Showcase are related events, but they are separate. So there are people who want to participate in the Showcase and thus have to do Connectathon testing so that they are testing with their peers before they do the demonstration. But there are also people who just choose to come to the Connectathon, and for whatever reason, they demonstrated last year, they have a work in progress that they're not ready to demonstrate, they just choose to come to the Connectathon for the testing opportunity that it is without participating in the Showcase. And both of those options are available to participants. If you choose to participate in them, there is a separate registration, contract and fees, and preparation activities associated with both events. Likewise, there is different management staff. I happen to focus on the Connectathon. There are experts who run the Showcase, and we'll share that contact information with you at the end of the presentation. So the bottom line for this slide is if you're signed up for the Showcase, it doesn't automatically translate into Connectathon registration, and vice versa. If you've registered for the Connectathon and you're interested in the Showcase, you have to go through that registration process for both events. Specifically, what's coming up in 2017 as we test the profiles that are being finished this summer. We have the North American Connectathon the last week of January at the Cleveland Convention Center and the HIMSS Interoperability Center in Cleveland, Ohio. Registration opens in the middle of September and finishes after the first week of October. So we have about a 3-week window during which you can register to participate. And there's a link on this slide to find out fees and links to the registration information as well. There is another webinar as part of this series that dives deep into the registration details for both the Connectathon and the HIMSS Interoperability Showcase. So again, we're whetting your appetite here without going into those details in this presentation. Just so that you know, these slides will be available and distributed after the recording. So if you're wondering how am I going to get this link, these slides will be available along with the recording after this presentation. And then in 2017, in February, the HIMSS annual conference in Orlando gives, in the middle of February, will give people the opportunity to do that demonstration of their IHE capabilities. And then following this, we have our European Connectathon every year in April. This coming year, it's the first week of April in Pisa. And again, those are equivalent demonstrations, some overlapping vendors. We see more European vendors, but both of those are international testing events. And we have staff, and the test cases that are run in North America are the same ones that are run in European Connectathon, and we try very hard for IHE to be consistent on an international basis. So just to give you an idea, if you may have heard about IHE Connectathons, but you're not sure what they're like, I'd like to just give you an idea of what happens during a Connectathon. This slide happens to show a photo from a European Connectathon But Ben commented to me yesterday, he says, gosh, that looks just like our Connectathon in North America. And indeed it is. During the Connectathon, it varies slightly from year to year, but you will be in the room with about 125, 130, 100, 100 plus certainly healthcare IT products, and 400 to 500 software engineers with a laundry list of tests to perform. And the question is how do I succeed in this environment? Well, we have preparation steps that make sure that once you register, when you show up at the Connectathon, that you know what to do and that you're equipped to succeed. So in general, during Connectathon week, you are assigned a set of tests, instructions, tests to run for each profile and actor you have declared or that you support, and you declare your support for those during the registration process. You will execute the tests with peer systems. So that means that you are performing tests with a test partner from another company. You choose your partners. You run through your test list under your own direction and test, find problems, fix them, and this iterates through over and over through the course of the week. We have what we call the 3 test rule, so we're running peer-to-peer tests here, and we generally, in general, each individual test we ask you to run with 3 different partners because we think, well, if you have demonstrated interoperability with 3 partners, it's a pretty good bet that you have implemented the specifications and you're demonstrating interoperability. Following your test, you will gather information about the success and the outcomes of those tests, and we have Connectathon monitors who are clinical experts. They come from universities. They know the underlying standards, and they examine the individual test results and decide whether you have passed or failed that test. That examination is done by independent volunteers. You are not being evaluated by your competitors. We have no vendors who perform that Connectathon monitor role. And then, so the monitors examine and pass individual tests, and then at the end of the day, a domain project manager like me takes a look at your overall test results, the collection of work that you've done, and I evaluate whether you have met the bar that we've established for demonstrating success in that actor profile, and we assign overall passing grades that are reported after the Connectathon. So in the thing to remember is that the Connectathon is an engineering event. You are in the room with your competitors, but anybody who's participated, and I've been involved in the Connectathon for 12 years in this role and a couple of years as a vendor, it is cooperative. People are there to find problems in their software, help other people fix their problems, and support each other to succeed by the end of the week. It is real-world testing, but it's in an environment where it's safe to fail because you might, run into a problem in your software on Monday, you fix it on Tuesday, you retest on Wednesday, and you move forward. And importantly, you will find it's a very efficient way. I grew up in the software testing industry. You can't beat the opportunity to be efficient in 1 week in exercising your software. But as I mentioned earlier, it's also very important in the IHE profile development process to have this real-world implementation. You'll find bugs in your software, but we also find chances to improve our specifications. Something might not be quite right, something might not be clear. We do change proposals, we fix the specifications, and only after that input of implementation do the specifications, the profiles become final text. So as I mentioned, initial failures can be fixed and retested later in the week. You manage your time during the Connectathon. We have a software tool that helps you know what tests you have to run, what partners are available for each test. But there's going to be nobody who's looking over your shoulder during the week telling you now it's time for you to test with vendor B, and on Tuesday you're going to test with vendor C. You manage your time, you do what's important for you, and work toward completion. And so if you, like we say, we don't guarantee that you complete your test, and what that means is that you are managing your own time. The scope and breadth of what you sign up to do is up to you. So at the end of the week, and after the successful completion, IHE will publish in its Connectathon results database the profile and actor pairs. So you always register for an actor and a profile, which represents the capabilities in your profile. We publish successfully completed results. We do not publish failures, and so all that means is that we encourage people to use the Connectathon for a testing opportunity. So if you have a use case or a capability that is under development but not quite finished, and you want to bring it to Connectathon to move it forward, and you just want to test with your partner knowing that you can't quite finish, in the end, we won't publish the fact that you tried and didn't complete it. You will have moved forward in your development, but from an external publishing results point of view, it says that you didn't even test that at all. This is not government testing or certifications of interoperability testing, and again, it's an extraordinary testing opportunity. And finally, successful completion of those profile actors enables you to take those capabilities to IHE showcase demonstrations, including those at the HIMSS annual conference. So if you're going to spend a week with your competitors and peers in the healthcare industry, how do we get there? So this slide is just intended to show that there is a process that we go through to help you prepare. And so if you sign up in September, it's not that you sign up in September, go away and do something else, and then just show up at the end of January. That's not the kind of event that we have. So I put the registration box in red font on purpose because when you register, you select the IHE profiles and actors that reflect the abilities of your product from an IHE point of view, and those selections during registration drive the entire process through the fall and into the Connectathon. It tells you who your partners will be because they have to register for IHE profiles as well. It tells you what tools you will use to verify your software during the fall. We roll out a set of software tools that do verification and simulation. So you're testing with a tool to verify your messages and documents before you actually test face-to-face. So the tools you run, the tests you run are all governed by that registration process. We gather configuration entries so you don't spend time during the Connectathon actually entering port numbers and IP addresses. We roll out test data in advance, and so after registration, technical managers like me will help you prepare so that you can use that Connectathon week to the best of your ability and working towards success. So one of the reasons we have this webinar series in the summer is that even though registration is in September, now is the time for you to think about what you might want to do. This is especially true for first-time vendors implementing IHE profiles and considering Connectathon participation. So in the summer, you should be thinking about matching the capabilities that are currently in your product or those that you want to develop next to IHE profiles, because you have to, as I said, you have to select IHE profiles when you do your registration. If you want to be in the showcase demonstration, your use case in the showcase may drive the profiles that you have to test during Connectathon to prepare for that demonstration. And then, of course, you have to think about the goals you have, the people that you have to apply to this, the budget and commitment it's going to take to prepare to get to that face-to-face event in January. So in deciding what you want to do, you're going to select profile actor pairs, what influences that decision, what you have in your product today, what you want in your product in the future, and perhaps what you want to demonstrate. But if you're brand new to IHE, how do I go about knowing what my product does from an IHE point of view? Well, you can tackle the IHE integration profiles in the technical framework. Ben mentioned Volume 1. Volume 1 is the high-level use case description for each profile and the actors and the actors within that profile. Volume 2 and 3 are sort of the technical details, so the messaging, the documentation structure, the implementation details are in Volume 2. So you start with Volume 1. Do they match your existing product or your plans for your product? If you're going to be in the showcase, you can talk to the showcase folks about the capabilities that you want to demonstrate and get feedback from them about how you will fit in. And in the third case, I want to invite you to use me as a resource. I often have conversations with first-time vendors in the summer who are thinking about IHE. They're not sure they want to do this. They know what they have in their product, but they have no idea about how close or far they are from an IHE point of view to implementing something. And I'm happy to set up conversations with you in the coming weeks and months prior to September to hear about what your product does. I can often point you to 2 or 3 profiles for you to read rather than trying to read the entire technical framework and try to fish through and find what's a good match for you. And so my contact information is at the end, and I offer a sincere invitation for you to reach out to me for a conversation in the coming months. If you wait till September, it gets tough because then all of that planning associated with what you may choose to do is sort of squished into a 3-week time frame instead of sort of the leisure of summer. Here is the contact information for you to do some post-webinar outreach. If you are interested at all in the committee activities that Ben described at the beginning of the presentation, I highly encourage you to reach out to either the planning or technical committee members. The names on the top of the slide, Daniel, Eric, Gila, and Morrow, are co-chairs of the respective planning and technical committees, and they will be happy to talk to you about a small way to get your toes wet in the committee, or if you're ready to jump in, again, we welcome your participation. Regarding the Connectathon and interoperability showcase, we kind of divide and conquer the management of the event because we have to get 500 people marching in one direction. And so Steve Moore from the Mellon Pratt Institute of Radiology, longtime, actually forever IHE participant, is the overall technical manager of the Connectathon. His email address is there. If you have specific questions or concerns about ITI domain testing and profiles, I write those tests. I can help you with that. I'm familiar with the tools that are contributing to the profiles. I can help point you to those tools as well. I also oversee testing for the radiology and quality research and public health domains. That's not listed here because this is an ITI-specific presentation. Feel free to contact me. Once Connectathon registration starts, the IHE USA staff supports the participants with fees and contracts and hotel and everything that's needed to make sure that you're comfortable and productive during your week at the North American Connectathon, and they can be reached at that connect5.IHE.net email address. And finally, we have a lead person for the HIMSS Interoperability Showcase, and if you're interested in sort of planning ahead toward February and looking in the future, you can hook up with her as well. And last slide, we gave you in the beginning a very high-level overview of the categories of integration profiles. The technical frameworks are found on IHE.net. The link is there to the IHE infrastructure specific section. If you want to read sort of 2 or 3 sentence profile summaries so that you can sort of focus your investigation, those are on the IHE Wiki. If you are not sure you're ready to reach out to the co-chairs of participation, but you want to monitor and watch the interaction between planning and technical committee members, anybody can join the ITI planning and committee mailing list. There are Google groups you can join, and you can monitor the schedule for meetings, questions that get posed to the group about technical frameworks, and just kind of see what those activities are like. You're welcome to join those Google groups. We have 3 specific links for Connectathon information for North America and Europe. And earlier I talked about the Connectathon results database where the people who passed and what they passed is published every year. The link to that is there. I didn't mention the product registry before, but vendors who implement IHE profiles in their products write what we call an integration statement, an IHE integration statement, which is a document which declares what product has what IHE capabilities. You can publish your integration statement as a vendor in the product registry so purchasers and providers can find out that your product has a certain capability, or you can find out what other companies have products that match the capabilities that you're looking for. You do not have to test it at Connectathon to publish an integration statement in the product registry, and we encourage all vendors to use the product registry as a resource. And finally, we invite you to the remaining webinar series. Every domain sort of has a how-to find out what's new in the domain. IT infrastructure is the first one, so you can check out that schedule on the webinar link. There will also be a Connectathon and Showcase specific webinar in the future, so find the schedule, sign up for those. We encourage you to do that. And in conclusion, just to circle back to the beginning to where Ben talked about the IT infrastructure profile being the underpinning of all of the domain-specific, clinical-specific profiles. I just wanted to share a few numbers with you from last year's North American Connectathon. So we had just over 120 test systems, which represent product implementation from 82 different companies and organizations. We had 74 volunteer monitors evaluating the test and overseeing the testing. Throughout the entire week, we had over 2,700 individual tests that were performed by vendors, participants, and evaluated by monitors, so 2,700. And of those 2,700, over 1,600, so 1,600 out of 2,700 were in the IHE infrastructure domain. That's not to say that ITI is better than all of the other domains, but it emphasizes the fact that if you're exchanging a clinical document in CDA, which is defined in patient care coordination, you're using that ITI cross-document sharing profile to share that document. If you're doing secure retrieval over the web, that ITI ATNA profile, the secure audit trail and node authentication profile, underlines that exchange. If you are in the quality research and public health domain, exchanging forms, you're testing quality research in public health, but you're also testing the underlying IT infrastructure profile. So I know both Ben and I, as longtime members of ITI, are committed to the value of the work in the domain that we do, and we hope that this presentation has sort of gotten you excited about joining us either from the implementation or profile development side of the game. So I'm going to pause here, throw it back to our host, who may know whether we have questions that either Ben or I can answer before we adjourn for the day. I know, Ben, can you see the chat window to see if we have any questions?
There are none at this time.
Okay, and that's not unusual. So again, I'm going to thank you for attending. We will post this recording and these slides on that webinar page that was on that previous slide. I can go back there on that webinar page. So if you have colleagues that want to view this, you can do that. Grab the slide, check out the information, reach out to people on the contact slide. And again, thank you for joining us. And I certainly hope that I see you in January at the IHE North American Connectathon. Take care. Thanks, everybody.